I think it's important that you understand that you are worth it. You are worth it. And some of us have done this for so long that we don't feel like we're worth it. Like, who's going to take the time to help me? Who's going to care about me? Right? Even if it's not a family member that cares, as clinicians, we do care. We do care. We got into this field because that's all that we do is care. Right? And if you're a clinician that doesn't care, you're in the wrong field. You have to care about this work because it is not easy work, right? It's not easy to convince people that they are worth it. It's not easy to convince people that they should make the change for their life, right? I'm pretty sure when you were going through your addiction, you were thinking like that. I mean, the last thing you would think about is that you're worthy of anything, right? This is what I get. This is what I deserve. This is what I set up myself up for. But you are worthy of recovery. You are worthy of a good life, but you have to make that decision, right? No one can make it for you. No one can do it for you. You have to make that decision. So, like I said, for my business, we are an opioid program located in Corona. We do have 3 offices, one also located in Moreno Valley and in Hemet. And like I said, without just giving out the name, you can do a Google search for methadone assisted treatment and you will find local programs if you have an opiate problem. If you don't have an opiate problem and you have a problem with any other substance, there's residential, right? There's intensive outpatient, right? But get into some type of care because you are worth it.
Last question before I let you go today. You mentioned
Yeah.
how sometimes the family members have a difficult time understanding addiction versus choice versus
Mhm.
the biological dependence. What would be your message to either those that are experiencing opioid addiction or the family members of those loved ones in addiction? What would be your message to them about MAT treatment or harm reduction?
I want you to look at harm reduction, treatment in general, but specifically harm reduction, because harm reduction does sometimes get a bad rap. As if your person, your family, your husband, your child was dealing with diabetes, right? You would encourage them to go get insulin, right? To take care of their diabetes. And that's kind of what I relate methadone, Suboxone to, right? A lot of people think that they should get on this and be on it forever. That was never the goal. The goal is to get you off of the illicit drugs, to get you on something to stabilize you, to prevent your withdrawal symptoms, and then get you off of that as well, right? So look at harm reduction as the middleman, right? The middle between being totally clean and being strung out on drugs. Let's get our families into these services so that they can get stable and then begin to live a productive life like we would like them to do. And educate yourself about addiction, because just like me, when I thought it was a choice, right? It initially is, but it doesn't become one after that. So educate yourself about what addiction is, what the different modalities for care are, so that you can be that safe space for your family member to get clean and to be able to be in recovery and be successful at it.
Thank you so much for being on today. Uh, your
You're
insight
welcome.
from your lived experience and your clinical experience, and then sharing that with our listeners. I know that it's going to help family members and people in recovery and clinicians to better
I hope
understand
so.
addiction. Thank you so much for coming on today.
Thank you so much for having me, Joshua.